Yes,
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 that's
sir.
right.
Indian nurses
Yes, Rahul ji.
Yes.
helping everybody.
Yes.
So you make us very proud, especially in this time.
Thank you, sir. Thank you.
We don't often get to say this to you publicly, but you are representatives of our country, and you are doing us proud. Not just you,
Thank
but
you.
millions
Thank you.
Thank you, Rahul ji.
men and women, brothers and sisters like you. So it's an honor for me to speak to you, actually.
It's an honor for us as well.
For us.
Now,
For us
you'll
as
be
well.
wondering why I thought I should have a chat with you, and there are a couple of reasons. One is there are some of you who are abroad, some of you who are working in India. All of you have a different experience. So I wanted to have a conversation so that we could get a sense of what different people are seeing in different parts of the world, and how they can help each other, or how you can advise some of our people, how our people can advise you abroad. So that's one aspect. Second aspect is I wanted to get a sense that you should feel, not just you, but as a community, you should feel that we are with you. We understand you're doing a dangerous job. We understand this is not an easy job. We understand you're putting your lives on the line for this. And we appreciate greatly what you're doing all over the world and in India. So I'd like to start by asking you to introduce yourselves.
My name is Shirley.
Yeah.
I work in Liverpool, England. I've been here for more than 21 years.
This is Vipin Krishnan. मैं विपिन कृष्ण केरला से हूँ बेसिकली 9 साल से दिल्ली एम्स में काम करता हूँ.
अच्छा, विपिन जी, आपको कोरोना हो गया?
राहुल जी, unfortunately.
So you are both fighting the disease personally and also on behalf of AIMS.
Yeah, both me and my wife are infected. We are right now in quarantine.
But I believe you're okay now.
Yes, I am perfectly okay, Rahul ji. I'm perfectly okay. Thank you, Rahul ji.
That is good news.
I'm Narendra Singh. I'm from Rajasthan, belong to the Sikar district. I've been working in nursing for 15 years. I did work in Jaipur, I did work in Ramano Loya Hospital, and the last job I did work in the Sabdazang before I left to the country. Now I'm working in Australia, New South Wales Health, Liverpool Hospital Intensive Care, and been working there 4 years, and looking after this old COVID patient. And now I think we learned a lot from last couple of months.
My name is Anu Regnat. So I'm from New Zealand. So I came here in 2004. So I work as a clinical nurse specialist for older people in the community. So in Northland District Health Board and Whangarei. So thank you so much for taking this time to talk to us Indian nurses. And yeah, you're really showing the compassion. So thank you so much.
So this must be easily the most difficult time that you have faced. I don't think any of you would have seen anything of this scale. Can you give me a sense of how you're feeling while you're sort of in the front line?
When this COVID started, we initially thought this is a simple flu. And we thought the flu is killing more people than COVID. So we didn't took really seriously this one. Once that COVID start rolling over, and then we see the news every day, and then Italy, the mortality rate is going higher and higher. Then that time we start thinking more, and we thought this is not a flu. This is really serious. I think we have to take very serious this one. And then we start preparing on that one, and then all the equipment, setting up the ICU, different ICU that's especially dedicated only for.
मुझे एक चीज की बड़ा आश्चर्य हुआ कि काफी अस्पतालों में दिल्ली में मुझे बताया जा रहा है कि टेस्टिंग ही अलाउ नहीं हो रही है.
हाँ जी राहुल जी, ये बहुत दुख की बात और दर्दनाक वाली बात है, क्योंकि मैं आपको उसके बारे में एक स्टैटिस्टिक्स बताना चाहता हूँ. क्योंकि 27 मई को हमारे दिल्ली का इन्फेक्शन रेट था 13.7%. उस टाइम पे हम 7,000 टेस्टिंग कर रहे थे एवरेज पर डे. अब हम जून 12-13 पे आ गया तो हमारी इन्फेक्शन रेट 30% के अबव बढ़ गया है, और हमने हमारी टेस्टिंग 5,000 की नीचे लेके आ रहे हैं. ये बहुत आश्चर्य की बात है, क्योंकि इन्फेक्शन रेट एक तरफ से बढ़ रहा है और डेथ्स भी बढ़ रहे हैं, और हम अपना टेस्टिंग कम कर रहे हैं. मुझे समझ में नहीं आ रहा राहुल जी, व्हाट इज हैपनिंग.
Because someone was telling me, one of the doctors I was speaking to in one of the private hospitals was telling me that it becomes impossible for them to work if they cannot test COVID patients. Because
Absolutely, Rahul ji.
The patient, they don't know whether he has COVID or not, where to put him, putting two patients, one who has COVID, one who doesn't have COVID next to each other. So they were saying that they are completely frustrated and they do not know how to move forward. I think little bit is the governments are trying to manage the perception. They're trying to give a sense that the problem is not as bad as it is. But I believe that, look, we have to face the problem. So we should accept the problem, define the problem accurately, and then fight the problem. I don't know how you react to that.
No, Rahul.
So looking back, for the people who are abroad, what is your biggest learning from this epidemic? What would be your advice to Indian hospitals, Indian nurses, Indian doctors, now that you've been through it? What would you say are the key things that one has to look at?
So wash the hand. Wash the hand. You have to wash the hand. During the day, like I do 12-hour shift. During the day, in 12 hours, we do 100 times.
Oh.
Wash the hand. Wash the hand. Put a proper PPE. That is quite concerned, because I was talking to one of my friend. He works in Delhi. We used to work together. He's saying me that a lot of staff and doctors are getting positive now, which is one of them Vipin as well. So ये बड़ी चिंता की बात है. If it's getting, it means there's something is missing in that. Either we are not putting properly PPE, either we are not using hand hygiene properly, or we not self-isolating, or maybe we are an asymptomatic carrier there.
In the front line, like the army, we can compare this like a biowar, because it's not a biowar, but a virus, a small microscopic organism, is challenging the whole world.
Yeah.
And our country. So we are fighting like the army or the Air Force. I'm not comparing this with our force, but at least I think you will agree with that. We are fighting as an army.
Yes, you're a non-violent army.
Thank you, Rahul ji. And I would like to bring into your kind consideration that risk allowance should be given to nurses and doctors at least at this point of time, because we are losing lives. We are exhausted. And we are fighting in the front line without any fear. हम कोई डर की बात नहीं है, हम आगे हम जीत जाएंगे, और आप और सरकार सब लोग हमारे साथ हैं, हमारा पूरे विश्वास है, इस कोरोना के खिलाफ हम ये जंग लड़ेंगे और जीतेंगे.
COVID battle, was there any experience that was positive for you, that you felt this was a very happy experience? Can you describe?
Definitely, yeah.
Can you describe me one experience like that? What happened? Anu?
I think here in New Zealand, again, the communication between the government and the health workers, it was really, really good. I would say daily at 1 p.m. during that 5 weeks lockdown, our health minister and our president would come and do the press meeting. And I think pretty much all the New Zealanders will tune to hear these numbers, the levels, and the president himself, she made us feel responsible and participating and winning this battle. So the leadership styles were like one of empathy in a crisis.
Yeah, my positive experience I would like to say about, during the weekends, during all this pandemic, COVID cohort unit, developed and working. And the cohort unit I worked at the weekend, none of the nurses had COVID. This was so, it was such a brilliant news for us, because nobody caught. We had 20 patients, and, all patients were admitted. There were COVID positive patients. None of the nurses had COVID. So
that's good.
That's good news.
So that was such a brilliant news for us.
So my last question. In all this, I feel that it's important that people also hear different voices,
Yes,
that's right.
So I feel that's why I'm holding these conversations, where whether it is nurses or it's experts in their field or it's manual laborers, whoever, but I feel everybody that makes up India should have a voice, should be heard.
Exactly.
I find you have given quite a good perspective.
Yes, absolutely, absolutely.
So I think we work as a team. We work as a team, and then win against the COVID-19.
So I'd like to thank all of you very much for your time. I know it's valuable because you're involved in the fight against COVID. So thank you very much, and very proud of you, all of you, for the work you're doing. Not only you, but millions of nurses and doctors like you who are from our country are doing an excellent job in India and abroad.
थैंक यू राहुल जी।
Thank you,
आपको भी
Thank
धन्यवाद
you.
देना चाहता हूँ, क्योंकि आप अपना टाइम, बहुत प्रेशियस टाइम हमारे लिए निकाला है और
Thank
इस
you.
कॉन्वर्सेशन किया है। बहुत 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 धन्यवाद राहुल जी। बहुत
Thank
बहुत
you very
धन्यवाद।
Yeah, so grateful.
Thank you.
And thank you for everything you've done for Wayanad too. I should say that. Thank you for everything
Yes,
you've
it's a
done
great
for
job. Great
Wayanad.
job.
Yeah.
Yes, great
Thank
job.
you.
Great job.
Thank you.
And for all the Indian nurses, thank you.
Organizing the